tell you one of the simplest exercise that you can do, which I think most people will teach you, whereby you just try to hold your urine. Yeah? You take a deep breath, you hold your urine, you count about 8 to 10 seconds. Hold the urine, hold it tight, and then release. You do that 3 to 4 times in one sitting, and you can do that multiple times. So this is a very, very easy exercise that you can do. You can do it on the go, you can do it at work, you can do it while you're sitting, while you're cooking, anything that you're doing, as long as you pay focus on doing that, that in itself strengthens the pelvic floor muscles. And also don't forget some abdominal tightening exercises as well, yeah, because we need the hip muscles and the abdominal muscles to help with the pelvic floor strength. Now, other than that, there are other things that we can do. For example, our diet modification. So we have to have a healthy diet so that we can shed our pregnancy weight that we have gained, okay, to go back to our BMI. Certain foods or drinks like caffeinated drinks, sodas, spicy food, all these are bladder irritants, yeah, which can actually reduce the irritation of the bladder, and so it reduces the symptoms. Okay, now other than that, things like what we call bladder retraining, meaning that we know we have this issue. Now what are we going to do? We train our bladder. We say, okay, now we're going to time and schedule our urination. At what time we're going to pass urine, what time we're going to pass urine, right? So as we go along, we start prolonging that time between one urination and the other. So we are retraining the bladder when to pass urine and strengthen the bladder back. So these are some of the things that we can do. Other more invasive or slightly more invasive things is like maybe some people have heard of this percutaneous tibial nerve stimulation that can be done. Usually they put a needle somewhere near the ankle that stimulates our tibial nerve from the leg, and that goes and stimulates the sacral nerves, which are actually controlling the bladder, and that sort of like blocks out some of the impulses to prevent the symptoms. So there are many things that we could do. So the simplest would be pelvic floor exercises, diet modification, keeping the exercise going pre-pregnancy, in pregnancy, and postpartum, and most of the time this can be sorted. If at all your symptoms persist despite all this, please get professional help, because there are things that we can recommend, and there are even surgeries that can be done to help you. Please do not suffer in silence.